So Amber, how do you think that went?
I think it went pretty well. I was able to, screen her for all the different substance areas and was able to give her, the recommended limits for women in drinking, and I think we got to a good point.
Okay. Yeah. No, I think overall, I think you did a good job. I just want to give you a little bit of feedback on the good things and then talk a little bit about things to work on in the future with other patients.
Okay.
So like you said, you did a good job screening for all the substances. That's very important. You did it in a non-judgmental way. She seemed to get a little defensive, but I think you were doing everything you could to come across as being non-judgmental and presenting her the facts. And I think you conveyed that you were concerned about her health and well-being. So I think all that was really good. We talk about, remember the ORs that we kind of teach you?
Yeah,
so you asked her one open-ended question.
Yeah.
You asked her, why do you think she drank as much as she did? I'm not sure the affirmations, kind of finding something to kind of encourage her that she's made a change in her past.
I don't really have time to do that, I didn't think.
Yeah, and I know we're really busy tonight. I know there's a lot going on. Like I said, what you did was really good. Just giving her that advice is more than most doctors would do. But to go the next step and to kind of work with her to come up with a plan really might help actually get her to think about changing a little bit more. To always look for something little that can really help kind of establish some rapport with her.
Okay.
You a couple times reflected back to her about that she thought she kind of drank normal in her peer group, which was really good to kind of reflect back to her that you heard her. That was nice. So you did a lot of good things. You did a good job of kind of giving her the advice that she really needed to cut down, informing her the drink limits and that. The one thing to work on is that you kind of came up with a goal for her and told her that's what she should try to do.
Right.
And it wasn't very clear that she thought that that's what would work for her.
So maybe I should have just asked her a question about what kind of goal would work for her first.
So to kind of see where she is as far as wanting to change. And
I thought it was sort of clear that that was what she needed to do, so I just wanted to make sure she understood that's what I would recommend.
Yeah, and it was very good that you did that. And for some people, they'll hear that and it'll kind of make them think that it's time to change. With her, she seemed a little bit kind of resistant. And, I know you're busy, I know you have other patients to see, but it can help to try and involve her a little bit more in coming up with a goal.
Yeah, okay. Maybe I could ask her a couple more questions about that, or what she thinks is a good goal or something. Okay.
Yeah, just to get a little sense of how ready she is to change the behavior and what might be more reasonable for her, and just involve her a little bit more.
Okay, I could try that.
Great.
Thank you.
But yeah, good job otherwise.
Thanks.